names are Jacques Iradukunda, and I'm going to start by defining what healthcare. Healthcare is the maintenance and improvement of physical and mental health, especially through the provision of medical services. However, all the people in the healthcare industry do not work directly with the patient. So there are some of the jobs that do not require working with patients. The first one is health information managers. These are people in charge of managing the healthcare information, and they are required to have a bachelor's degree in the field. The second job is the medical transcriptionist, which requires an associate's degree in the field. The third is the healthcare administrators, that requires a master's degree in the field. The second point to discuss in this presentation is the allied health professions and some of the professions in the allied power. Allied health professionals is the segment of the workplace that delivers services involving the identification, evaluation, and prevention of diseases and disorders, dietary or nutrition services, and rehabilitation and health system management. This is a way that people working in the health can can be doing different things to help people having different health conditions. So they have different professions like dental hygienists who deal with helping patients have clean teeth, dietitians who deal with helping people to have a healthy meals, medical technologists who deal with using technology treating people's diseases. There are also rehabilitation and counseling who deal with providing counseling to people with trauma and other mental problems. There are respiration therapists who deal with helping people with the respiration problems, and there are speech language pathologists who deal with helping people who have language issues. So the third point to discuss is about the licensed practical nurses and the registered nurses and nurse practitioners as well, and their associated educational requirements and their job requirements. So starting with licensed practice nurses, their level of nursing is the basic medical care. They just provide the basics of medical care. The educational requirements, they go through a 1-year approved educational program whereby they learn about biology, nursing, and pharmacology, and lastly they pass a national council licensure examination to be called licensed practical nurses. Some of their job responsibilities include monitoring patients' health, administering basic patient care including changing bandages and catheters, providing for the basic comfort to patients, such as helping them to bath or dress. They keep records on patient health, and they can report the patient status to registered nurses or to doctors. The second category of nurses are the registered nurses. Their level of nursing is the applied nursing. Their academic requirements, they are required to have a bachelor's degree or an associate's degree or a diploma from an approved nursing program. Some of their job responsibilities include recording patients' medical histories and symptoms, administering patients' medicines and treatments, setting up plans for patient care and contribute to existing plans, and operating and monitoring medical equipment, and they can also teach patients and their families how to manage illness and injuries. Again, they can also explain to patients what they can do after the treatment was done. The third category of nurses are the nurse practitioners. They also do applied nursing as their level of nursing, and they are required to have a graduate degree in the nursing program, a national certification and a certificate from their specific state. In the United States, specific states provide specific certificates to nurse practitioners depending with the states that they live in. So some of their typical job responsibilities include ordering, interpreting, and performing results of diagnostics tests. They analyze and interpret patients' histories, physical findings, symptoms, or diagnostic information. They also develop treatment plans on the basis of standards of care, scientific rationale, and professional practices. They diagnose and treat acute health problems such as injuries, infections, and illness, and they detect and respond to adverse drug reactions. Thank you so much.